Hello, I'm Ben Lawson with Burk I.T. Today I'd like to discuss a word and a series of acronyms that have caused a great deal of confusion and frankly a sense of dread amongst doctors and medical offices around the country. The word I'm referring to is compliance, and the acronyms are HIPAA, HITECH, and PCI. So why this sense of dread? Why this sense of worry, and why this confusion? Well, up until the last 15 years, compliance from a medical perspective has dealt largely with just how procedures are done, how patients are cared for, what's done in terms of complying with hospital standards, and the regulatory practice around the medical procedures themselves. Then in the early 90s, Congress passed a series of laws that required doctors' offices, insurance providers, and care providers around the country to provide information and deal with the portability of patient information from one system to another, and to make those records electronic, to make them available to patients for a variety of reasons. That law was HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act, which basically means that doctors' offices, medical practices, insurance providers, hospitals, and other medical organizations were required and incentivized to create and take paper records and make those into electronic records, to create electronic patient health information so that that information could be more easily provided to patients, so that it could follow patients from one doctor to another, so that that information could be used in meaningful ways. The term meaningful use came from this law, so that in that meaningful use, it could be used to create trends, to do data analysis, to find new cures, to compare patient information over time. Largely, it was a law designed to improve patient care and to improve the portability or the transport of that data from one medical organization to another. The challenge has been doctors' offices and medical practices have not had in the past a mechanism to deal with these systems. They had to go to new electronic medical record systems, electronic health record systems. They had to deal with all the technology barriers that come with this type of procedure, this type of process for handling medical records. They didn't have an infrastructure designed to deal with the security implications of this amount of personal information associated with patients. They didn't know how to deal with it. And it's been confusing because with HIPAA came HITECH a couple of years later, which is the enforcement arm behind the HIPAA legislation that basically says there are penalties if this information is not handled appropriately and how it should be dealt with. The third acronym that I mentioned is PCI. PCI stands for the payment card industry, and they have a document or a standard referred to as the DSS, the data security standard for all credit card and debit card transactions. Why is this important to medical practices? Because medical practices largely take credit cards and debit cards as that copay when you enter the office or as a mechanism for payment for your procedure. So they have to meet that standard, that set of requirements that is governed by the branded card industry, Visa, MasterCard, American Express, and so forth. And they have to deal with the federal legislation that is HIPAA and HITECH. So what is this challenge? Let's talk a moment about HIPAA. HIPAA is largely centers around two rules, the privacy rule and the security rule. The privacy rule is just that. It's the national standards designed to protect the privacy of an individual medical record or other health information that's generated through medical procedures and the visiting of doctors and hospitals and medical practices. It's all of those things. It's how you talk about the patient, how you talk with the patient, who you can share patient information with, what you do to obscure patient information in a public or private setting, how you deal with physical records, how you communicate amongst organizations. It's everything that involves the privacy of that information. Coupled with the privacy rule is the security rule. The security rule is designed specifically to address electronic patient health information, e-PHI. It involves the administrative, physical, and technical safeguards and controls that surround that. How do you defend and protect the PCs, the servers, the laptops, the tablets, the smartphones, the electronic fax transmissions, access both locally and from a wide area perspective for information traversing computer networks, information that can go over the internet, information that can leave via an email or be transferred to an insurance provider. All of the technical controls, administrative controls, and safeguards that surround patient information. Why is this difficult? Most medical practices are not large organizations. They're not huge hospital networks. They're not huge insurance providers. They're 1 or 2 or 3 or 4 doctor providers that have a limited staff and don't have usually dedicated internal IT security personnel to help navigate these challenges. The security rule revolves around what NIST and many others refer to as the CIA triad: the confidentiality, integrity, and availability of this information. How do you keep it confidential? How do you keep it away from those that don't have legal or ethical access to it? How do you make sure that the integrity of the data is intact? It hasn't been manipulated. It hasn't been changed over time. It hasn't been altered in some way. And how do you ensure that it's available to the patients when they need it? That you have relevant backups and safeguards in case something happens with a computer, a laptop, a tablet, or a server, and that information is available when needed, either for primary care or for historic or forensic purposes. These are difficult challenges for many doctors' offices and medical providers around the country. You couple that with the fact that with the security rule came a series of requirements or procedures or processes that need to be followed. Processes like antivirus, anti-malware, firewalls, regular vulnerability scanning of networks, and more importantly, risk assessments and security assessments of the practice itself. How do you assess how you're dealing with risk? How do you manage and mitigate that risk? How do you ensure that all the security safeguards are in place and that you've taken care of this? This challenge has been exacerbated by the fact that a lot of IT providers and a lot of small medical offices have fallen back to a checkbox approach, a spreadsheet or a list of just question and answer. Have I done this? Have I done that? Have I met this requirement? How have I dealt with risk? And the challenge with that is those checklists, those spreadsheets don't meet those security requirements. And if they're done in-house, if they're not done by IT security professionals, then they're not necessarily accurate, and they're not necessarily taking into account industry trends and best practices. I'd like to provide you and show you on the screen here an example, and I know it's going to be difficult to read, so I'll read some of this in the video. But the CMS website, cms.org, which is the Centers for Medicare and Medicaid Services, provided this eHealth University content and this tip sheet on how to deal with security risk analysis for providers that deal with Medicare and Medicaid insurance reimbursement. And it deals with some of the myths and facts that are surrounding these procedures. And one of them is, do small providers, these small 1, 2, 3 doctor, or even 10 or 12 doctor practices, have to actually go through security risk analysis? The myth is that they don't. The fact is that they do. All covered entities under the HIPAA regulation, which is everyone who provides these services, has to go through this procedure at least annually or when any significant changes take place in their environment. They have to do formal risk analysis that takes into account security, IT security, controls, mitigation, and remediation practices. Another often overlooked or misunderstood myth is you either have to or you don't have to outsource your risk analysis. The truth there, the fact is, no, you do not have to outsource it. But you have to perform it in such a way, you have to perform risk analysis and security assessments in such a way that they are professional, that they are thorough, that they cover all the bases, your policies and procedures, your technical controls, your administrative controls, your security awareness training and HIPAA training that you provide your employees and your doctors. All of those things need to be accounted for, documented, and reviewed by someone who understands the standard. And they have to be based on an industry best practice, a standard like NIST, which is the federal government's industry best standards, or other standards like ISO, COBIT, other standards that can approach a risk in a methodical way. So can you do them in-house? Yes. Do most offices and medical providers have those resources and the staff to do that? Most do not. And that's where they can find themselves in trouble and find themselves lacking in terms of risk analysis. The final myth here says, can a checklist suffice for the risk analysis requirement? And though it can be a useful tool, no, it cannot. It actually has to be a formal process that takes into account IT security and that all the documentation in a very systematic way has taken place and has been reviewed by the provider. So these are challenges that face our medical providers and doctors around the country. So you may ask the question, Yes, compliance is important. Yes, this is a law, but are there any teeth to this law? Why do we have to take this seriously? Why don't we just ignore it, turn our heads, pretend it's not a problem? Well, unfortunately, as I mentioned, actually, fortunately, depending on how you want to look at it, unfortunately for those that want to avoid the issue, fortunately for those of us that want our information protected and secured, Congress passed the HITECH law, the HITECH Act that followed HIPAA, and it provided penalties, financial penalties for the loss or breach of data by medical providers and those that are covered entities under HIPAA, and associated those penalties, those financial penalties, with the amount of reasonable diligence and due care that the provider took when securing their environment. As you can see from the screen, these penalties scale. If there's been a breach that the provider or the person or entity did not know about and had taken due diligence and reasonable diligence to provide protect their environment, and yet this happened, the penalty is not to exceed $25,000 in any calendar year, and it's only $100 per individual violation. When we talk about this, these laws, the HITECH penalties involve breaches or loss of data exceeding 500 records. Now, to be honest, most medical offices will easily exceed 500 records for any system that they have. They see 500 patients often in a week or just a matter of a few days. So these penalties generally apply to all those covered entities. But these penalties escalate based on how much preparation, how much diligence a practice has taken in securing their environment. Where a lot of people will find themselves is in that second and third tier, where there was not willful neglect, but they didn't necessarily follow the due diligence requirements of a standard when evaluating security and risk for their organization. The third tier, I think, is the most dangerous area for providers to find themselves in, because once they're educated, once they know that the possibility of breach exists, once they know that there are certain standards for HIPAA that they have to comply with, they would find themselves in the willful neglect category because they knew there was an issue, but they neglected to address it in some meaningful or effective way. Then they would find themselves facing $10,000 fines per individual record lost, not to exceed $250,000 in a calendar year. That's a lot of money to a small medical practice. In many situations, breaches like that can cause a practice to have to close its doors. These are difficult things to address in terms of how you consider the financial cost, the cost-benefit analysis around securing your environment properly and avoiding these penalties versus rolling the dice and hoping that you don't lose information or that you're not audited. I mentioned the term audit because the Health and Human Services division of our government is performing HIPAA audits throughout the country. Their goal was, over a 10-year period, to audit the entire nation, to do approximately 10% of all providers each year, and then over a 10-year span to have audited everyone. Those audits started in earnest about 5 years ago, and they continue to move forward. And the biggest challenge when interviewed when Health and Human Services officials were interviewed was most practices do not understand security risk analysis and security assessments for their organization. They don't understand that importance. They find themselves lacking. So these are all things that medical practices need to take into account. You need to take into account the need to have a trained IT professional or a specific standard process from someone who understands industry best practices to come in and evaluate the security and overall risk facing your organization as a medical provider or a doctor's office. Now, we also mentioned PCI. PCI is a standard that comes from the payment card industry that is designed to protect card information, credit cards and debit cards, to make sure that information is not leaked, that it's not stolen, that it's not abused. And if anyone in the world that owns a credit card has not dealt with this at some level, I would be shocked, because we see numbers and ranges of credit cards breached and compromised and replaced on a regular basis. So the PCI standards have gone a long way to limiting that exposure and continue to grow and evolve year after year. We've recently reached PCI standard, DSS standard 3.3. And in it has several requirements that organizations have to follow. These requirements apply to everyone. These apply to massive, large, big box retailers that take tens of millions, if not hundreds of millions of credit cards each year, to small providers that take a few thousand credit card transactions each year. Everyone has to adhere to the PCI DSS requirements. Now, these requirements are scaled based on the number of credit cards that you take and the way you take those credit cards. Do you have encrypted terminals? Do you take them through a workstation that has an internet connection and you're keying them in manually? Are you taking them at a large point of sale, or are you taking them and writing them down and keying them in batch process? All of these things affect how you have to adhere to the data security standard from the PCI Council. All of these, though, also do apply to all of our medical providers and doctors' offices that take credit cards and debit cards for those copay transactions and for bill pay over time. I picked out a few of the standards that are often overlooked that overlap with the HIPAA standards that we've already discussed. The data security standard of DSS section 11.2 speaks specifically to the requirement that all organizations that take credit cards and debit cards have to do internal and external vulnerability scans, so scanning all of your network and computer, PC, and server resources at least quarterly, from the outside of your network pointing in, and from the inside of your network looking at all of your devices, each quarter to determine, have I missed patches, do I have misconfigurations, are there known vulnerabilities for applications that I'm running that could place me at risk. This is a requirement. This is not a suggestion. This is not scaled down just because you only take 15 or 20,000 credit cards a year, or because you take 10 or 15 million credit cards a year. Everyone needs to adhere to this. DSS section 11.3 points to the requirement to have a methodology for penetration testing. After I do vulnerability scanning, at least annually, I need to perform penetration testing to find out, are those vulnerabilities actionable? Could someone actually enter my organization, leverage the vulnerabilities that I have, an outdated version of an Adobe product, a missing patch for a Microsoft operating system? With those vulnerabilities, could someone infiltrate my network and steal information, potentially stealing credit card information? You have to do that at least annually. This has to be part of your annual security assessment and your overall risk profile. It's a requirement. And finally, section 12.2 talks about the need from a PCI perspective to also have an annual risk assessment, or an assessment anytime any substantial changes take place in your network. This is so that you address anything new that comes into place, any growth or reduction in your environment, any changes to the way you communicate with the rest of the world, new internet connections, new connections to providers, new technologies, new servers, new EMRs, new credit card payment mechanisms, new payment terminals or PIN pads. All of those things need to be addressed and measured from a risk perspective. These are all requirements. Now, where would I leave you with this conversation? Now, I realize that sounds like a lot of doom and gloom and complication and difficulty, and a lot of folks have no idea where to start. Where I tell you to start is find a very good IT service provider that understands these issues, that has a security professional on staff that is well versed in PCI standards, HIPAA standards, and the penalties associated with HITECH, that can bring to bear a series of engineers and team members that can address these vulnerabilities, that can tighten these controls, that can secure your environment appropriately. Let me be very clear. The penalties associated with these acronyms are very real. We see every day medical practices, doctors' offices that are either having to shut their door or come up with, in many cases, hundreds of thousands of dollars, if not millions of dollars, to cover the penalties associated with data breach. In terms of PCI, the risk that you face is not only penalties. You can be penalized each month by your card processing environment. You can lose the ability to take Visa, MasterCard, American Express, or other payment mechanisms, which could severely impact the profitability of any organization. So please take these compliance requirements into account in your organization. Take steps to evaluate your risk. Take steps to have well-educated and industry best practice knowledgeable individuals and IT security professionals to perform security analysis of your environment and to perform an annual security assessment to know where you stand. Take these things seriously, because above and beyond everything that involves compliance, you want to be secure. You want to provide peace of mind to your patients, to your customers, that you're doing what you need to do to protect their information. As I have said for many, many years, our goal should always be security. Our goal should always be to be as secure as possible. If we are secure, if we've done our due diligence, then we are by definition going to be compliant. But just because we've checked some boxes, just because we've read the compliance standard and we've given it a nod, does not mean we're secure. It does not mean that we've done all that we can do to protect our patient information and our customer information and protect our organizations. The two have to come in the other order. Security comes first. Compliance by its very nature follows. Again, my name is Ben Lawson with Burk I.T. Hopefully you found this video that we've posted to our YouTube channel valuable. If you have any questions, feel free to follow up with us. I look forward to talking to you soon.